A very good morning to Dr. Suzy and my fellow friends. I'm Dina binti Anwar and I'm from Group 15. So under the topic of wave optics, I'll be explaining more regarding nuclear medicine. So many of you must be wondering, what is nuclear medicine? So from the research that I've done, I've read that nuclear medicine is the medical specialty that involves the application of radioactive elements in diagnosis and also treatment of diseases. So nuclear medicine actually uses only a small amount of radioactive elements that is normally injected into the bloodstream, swallowed, also inhaled. Next, now we are going to find out what are the diseases that are normally treated with nuclear medicine. So one of the diseases could be hyperthyroidism, lymphomas, thyroid cancer, and also bone pain from certain types of cancer. So under nuclear medicine, there are two common procedures which include a diagnostic procedure and also therapeutic procedure. So under diagnostic procedure, heart disease normally can be diagnosed with a stress test using a sesame B scan which contain technetium-99m or through the usage of PET scan. So what is PET scan? PET scan is basically a positron emission tomography, which is normally used by the doctor to obtain more data or information on how the organs in our body are functioning. Next is the therapeutic procedure. So under therapeutic procedure is more likely a radioimmunotherapy, which use radioactive elements such as iodine-1T390, which is tied to an antibody that targets a specific cancerous cell. So many of you must also be wondering, are there any health effects associated with nuclear medicine procedures? Well, Nuclear Regulatory Commission, or better known as NRC, US Drug and Food Administration, NDA, state that the usage of radioactive elements for nuclear medicine procedures are safe. However, exposure of too much radiation can quickly damage our organs and also tissues that can lead to the risk of cancer after years of exposure. So that's basically it from me about nuclear medicine. Thank you, Dr. Suzy. Thank you, everyone. Stay safe, stay home, stay indoor.